We're going to get started just so that we get to hear all the wisdom that Professor Kamradt-Scott has to offer. So it is I'm Nahid Badalia. I am a faculty in the School of Medicine here at Boston University, and I'm the founding director of the BU Center for Emerging Infectious Diseases Policy and Research. It is really our pleasure and our honor to welcome Professor Adam Kamradt-Scott, who is the Dr. Jiang Yanyong Visiting Professor of Global Health Security at Harvard T.H. Chan School of Public Health. Dr. Kamradt-Scott's research, teaching, policy engagement work has focused on governments and multilateral organizations and how they respond to adverse health events, such as epidemics and pandemics and other emerging infectious diseases threats. Adam's prior background has included work as a health professional specializing in emergency care and clinical research management, a political advisor to multiple governments and organizations, as well as a public servant during the national pandemic response in his home country of Australia. He holds formal academic qualifications in health, international relations, international law, and more recently, he has served as a consultant to the Australian government and the World Bank on pandemic preparedness and COVID-19 response. Is continuing to advise the Australian government on the latest proposed changes to the international health regulations and the pandemic treaty, the subject of his talk today. He's also the co-founder and convener of the Global Health Security Conferences and currently serves as the chair of the board of directors for the Global Health Security Network, a multidisciplinary professional association dedicated to promoting evidence-based policies to improve health outcomes. Thank you so much.
Thank you. Thank you. Thanks, Nahid, for the invitation, and thank you guys for coming along today. Because I do have this formal role, I do need to include a short disclaimer. No. Sorry, we did test this just a moment ago. Okay. So just a short disclaimer, anything that I say cannot be attributed to the Australian government. I'm an academic at the end of the day. So please don't think that anything that I say here is any official position implied or otherwise. We've ended up in a situation though, and it's quite a fascinating development in many respects, that early on in the pandemic, there was a recognition that the international legal arrangements that we've got for responding to a pandemic were not necessarily fit for purpose. And so there was a recognition that we needed to do better in that context. Normally though, and I think this is important to sort of try and explain what happens normally when you end up with a treaty being negotiated. And that is that, we identify what the problem is first and foremost. The problem identification is really quite essential. Then there's a discussion usually as to what is the best way or mechanism to deal with that problem. And in a very rare number of circumstances, you then end up with the idea that we need an international treaty. Now, there's a lot of challenges out there, a lot of global challenges that are dealt with by governments on a bilateral basis, even on a multilateral basis, that don't require a treaty. So the idea of a formalized treaty is more of a rare event, although what we have seen, particularly throughout the 20th century, has been a continual explosion, I guess, or expansion of the number of international treaties that are being negotiated. Then once you actually get the agreement that yes, a treaty is required, there's a process then whereby you'll start to actually work out what needs to be in the treaty. And then there's a two-stage process of adoption of the instrument, and then governments need to what's described as ratify the treaty. So they then need to pass domestic legislation to give effect to their international obligations. So you can sign it first to say, yes, we intend to be bound by this, and then you ratify it within your own country. What we've had as a result of COVID, though, has been a little bit of a change in the normal sort of process. So what you've kind of traditionally got is a process whereby the form, as in the treaty, follows the function. So it's that sort of standardized process of like, this is the problem. Actually, the best way to deal with this is a formal treaty, and then you go through the negotiations. What we've had with the current arrangement was actually then the proposal for a treaty, which got promoted very publicly by the European Union in December of 2020. There'd already obviously been some speculation as to whether or not a treaty might be required. But certainly in 2020, there was this formal proposal coming out. And then from there, we've actually seen a fair amount of lobbying. One of the more interesting developments, I think, for global public health in this context has been that the World Health Organization, and particularly the Director General, came out very early advocating that a treaty would be an appropriate step to take. And that's kind of unusual because normally when we see the World Health Organization, it is a member state-led organization. So its bosses are governments. And normally in that instance, you find that the Secretariat, including the Director General, is more sort of behind the scenes there to support what governments are asking for, rather than sort of potentially lobbying or leading a process. So this has been slightly unusual. In amongst all of that, then suddenly they were like, okay, let's have a treaty. And then there was the question of like, what's the treaty going to cover? We all kind of knew that the COVID response internationally didn't go as well as what it could have. But the idea as to then how we fix that, what the problems were, has been one of the key points of discussion. And then there's been a very confusing, sometimes, discussion about what the process is going to follow. And for those of you, is there anyone that's really passionate about international law? One person, two people? Okay, all right. So for the World Health Organization, under its constitution, there's two different mechanisms by which it could adopt an international instrument. One is Article 19, which is its conventional sort of treaty-making powers. The WHO's only ever utilised those treaty-making powers once, which was in relation to the Framework Convention on Tobacco Control, which was the WHO's first ever treaty. There's another mechanism, though, called Article 21, which allows the World Health Organization to adopt what are called regulations. And that power has been utilised twice, both with regards to the classification of diseases and what's called the International Health Regulations, which was the only sort of internationally binding instrument that we had prior to this proposal for a pandemic treaty. And so there was a bit of a discussion for quite a while as to should this be a instrument that's adopted under Article 19 or should it be adopted under Article 21, because it has different effects as a result of that process. And there's been this fairly sort of back and forth at various different times as to what this process was going to be, how this was all going to be unfolding. And in that context, you kind of have the reverse where the function is following the form. So instead of it being that conventional sort of problem identification, now we move towards the treaty, it's kind of gone the reverse. We then also had a bit of a disagreement or at least a big question mark as to where the instrument should be negotiated. And for those of you who might recognise these two different symbols, there is the World Health Organization and the United Nations. And I think a case was reasonably made that perhaps this treaty should be negotiated under the auspices of the United Nations, principally because what the pandemic instrument, or if we wanted to sort of make sure that we had a good comprehensive instrument, conceivably starts to deal with a whole bunch of other issues, some of which actually fall outside the authority of the World Health Organization. And in particular, when we're talking about issues like One Health, that it starts to include or impact on the responsibilities that other UN agencies and one private international organization in the form of the World Organization for Animal Health also impacts on. And so there was a proposal there initially that perhaps actually this should be conducted under the United Nations, but there was a very strong push to avoid the treaty negotiations coming to New York. And so Geneva ended up winning out. And so the agreement was there for WHO to be the forum whereby this treaty would be negotiated. There was a couple of options then that we could look at as to how the instruments or what were the options or the modalities, I guess, of this idea about a treaty. So one of the proposals was that we could revise and update the international health regulations, which is this, up until this proposal for a pandemic treaty, this is the only international instrument that's been guiding member states since 1951. It got radically revised in 2005, but fundamentally, we could revise and update that and make that better. Then there was the proposal for the pandemic treaty. And there was a lot of talk about, well, let's utilize the same approach that WHO took with the Framework Convention on Tobacco Control, so it becomes a Framework Convention. Some of you might be more familiar with the Framework Convention on Climate Change, for instance. Basically, what these are fairly high-level, overarching principle sort of treaties, and then you work out the details through what's called additional protocols to give effect to those principles. There was another option on the table, which was to actually work on the basis of pursuing a whole series of singular individual treaties. Now, and to put that in context, normally when you look at international treaties, you do find that they tend to deal with one single issue. For instance, landmine, prohibition on the use of landmines, or intellectual property rights and things like this. But actually what we saw then was a move away from the idea that we would try and negotiate multiple different treaties on various different topics and would take sort of more of a framework convention approach. And the fourth option then was to look at adopting new regulations under that Article 21 of the Constitution that I mentioned earlier. Ultimately, what won out was a process to revise and update the IHR, as well as then pursue the adoption of an international treaty. The proposal in particular to revise and update the IHR actually was really strongly advocated or encouraged by the United States government. That has the reason why the US, or one of the reasons why the US was advocating for this, is because of the distinction between this Article 19, Article 21. So if an instrument adopted under Article 21 of the WHO Constitution, it becomes automatically binding on all member states. Right? So if they adopt an instrument under Article 21, it's automatically binding, and countries have to write to the Director General and to say that they are opting out of that arrangement. So they actually have to remove themselves intentionally, otherwise they're bound by it. Conversely, an instrument adopted under Article 19 is a standard treaty. So there's that two-stage process of treaty adoption and ratification. So you have to sign and then ratify the treaty. And so you've got to opt in. Because of that difference and that key difference, the IHR is a really good instrument in many respects because it's automatically binding on everyone. And if you're dealing with a pandemic, you kind of go, well, actually, you want the rules to apply to everyone all the same, right? You don't want the risk that some governments might go, actually, we're not going to agree to that proposal and therefore not sign and ratify a treaty. But there was a domestic rationale for the US government to also encourage this, which those of you who are US citizens or if you've studied US politics, you might appreciate that the US Congress doesn't have a great history on ratifying treaties, even when the US has been the country that has proposed the treaty in the first instance. And so there's a genuine sort of concern there from the US government side of things to make sure that if they're going to go through this process of negotiating a treaty, that then it would actually be applied and that the US would be party to it as well. And so in that instance, revising and updating the IHR is a really good option because once it's agreed in the World Health Assembly, it's automatically binding on everyone. It doesn't have to go through Congress to get adopted and ratified. What has happened since the proposal for the treaty then was a period of consultation as to all of those sorts of issues being worked out, how it was going to happen. Ultimately then, there was a special session in the World Health Assembly in 2021. And it was agreed then that the World Health Organization would create what's called the International Negotiating Body, or the INB for short, to then negotiate this pandemic treaty. And since that, or from that point, there was a series then of public consultations initially where anyone was able to make a representation. And that's the first time WHO has ever done that. But they were really conscious that We wanted to try and engage civil society organisations, academic institutions, as well as governments to try and make sure that we're building an instrument which addresses all of the challenges that we need to address. And since that point, there's been a series of meetings that have been held and we're now past, and they've set out a time frame for this. So just to give you a sense of that time frame, you can see that there's been quite a number of meetings, you know, December, January, February, March, April, May, June, July. They're meeting basically every few weeks. Now, this is the negotiation schedule for the pandemic treaty, the INB. Importantly, you've got a two-stage process happening though, because they're also revising and updating the international health regulations at the same time. So, and what we're seeing is that the negotiations around revising and updating the IHR are happening in between these dates. So it's a very busy schedule that governments have been working towards over the last 12 months in particular. And where we're up to now, so we've just had last week the start of the 7th INB meeting. And that meeting is going to be continued over 3 days at the beginning of December. And this meeting has been important because it's the first time now that we've actually got a negotiating text and what's technically referred to as a zero draft in international law. So what they had done prior to that was they had a consultation process and they developed what was called a conceptual zero draft, which was like, these are all the different topics that governments have said to us they want considered, being included in the treaty. And they've gone through a consultation process and they've progressively then tried to refine that down to now what is a text of that of the proposed treaty. And now anyone can access and have a look to see what the text is. It was released to member states on the 16th of October, and then it was publicly released 2 weeks later at the end of October, ahead of the INB meeting. Importantly though, there's only 6 months left now, because governments agreed back in 2021 that they wanted to make sure that the instrument was adopted in May 2024. Now that's significant because every May or May of every year, the World Health Assembly meets. So that's the big decision-making body of the WHO. It's comprised exclusively of governments. They're the only ones that can vote. And so governments want to have the treaty basically adopted or ready to be adopted by the World Health Assembly in May of 2024. That is a very ambitious agenda, particularly that we are now 6 months away and we've only now just got the zero draft. Now, I can't tell you the nature of the conversations that went on last week. I have spent a good 6 hours of my life watching the public debate of member states on the first day. That is available. Anyone can go on and access it and have a look to see what governments were saying on the very first day. That was the public forum. But then all the textual negotiations that have occurred from the Tuesday through to the Friday are closed. So they're not open to the public. We might hear, well, we will see the outcome of those discussions with the next meeting, because we will start to see changes to the current text, which is of the instrument. Usually when in international law, in negotiations, when there's question marks about the text, they use square brackets. So you'll be able to follow along if you're really interested in this yourself to see where the contentious issues were, because they will appear in the next draft of the treaty with square brackets around the text. That is still, that means there's contention or disagreement between governments. And I think it's important, you know, when this whole process started to propose a pandemic treaty, there was a whole bunch of ideas to what needed to be included in the instrument. One of the more interesting proposals that I found, at least, was this idea of whistleblower protection. I find that interesting because I come from a country which doesn't even really have whistleblower protection. You know, if basic, and a whistleblower is, you know, if governments are doing the wrong thing, that someone like a public servant or someone who has access to that information will come out and blow the whistle, as in make it public. Now, this idea was proposed because we've had a couple of instances now whereby governments have attempted to hide a disease event, and it's actually been medical doctors that have come out publicly and notified the international press to say, we've got a disease outbreak underway. And so one of the ideas was that, you know, you would have this whistleblower protection. Now, as you can see, there's quite a number of proposal and various different topics there, which were proposed by governments, by academics, by the private sector, which has also got an interest of particularly the pharmaceutical industry. So there's been a whole range of different issues. When we go through the instrument and look at what is still included, that gives you a sense of how many topics the pandemic treaty is proposing to address. So there's proposals in there, for instance, now to create a pandemic preparedness financing mechanism, which has concerned some governments already, given that the World Bank only recently established a pandemic financing. So they were like, why would we need yet another mechanism? So it'll be interesting to see how that proposal goes. But there's, you know, emphasis is in there on protection of human rights, as well as then things like access to vaccines and medical countermeasures. And there's a variety of different proposals looking at how we can improve equity and access in that context. And basically, what I want to sort of do for the rest of this remaining time is then sort of focus on some of these issues, and focusing on one particular issue, which is the proposal around access and benefit sharing. But first, just to sort of cover off, there's a couple of elements here, I guess, which it's always still good to keep in mind. The emergency of the pandemic has officially been declared over, but we know that COVID is still circulating. And on that basis, there's always potential for the virus to have another mutation. If it was to develop a mutation which eliminated the protection that is afforded by the current vaccines, we could still find ourselves going back into lockdowns and things like that. So I think that's an important context in that really this crisis is not really over just yet. We're all able to sit here at the moment without face masks, which is great. I'm sure we all appreciate that. But at the same time, we are seeing that, you know, there's case numbers rising all around the world again at this time of year. There has been, one of the aspects to this proposal has been that it's also been much more politically driven, as opposed to a clear legal rationale for the treaty. And I think that's important because at the moment, normally what you have when the treaties are proposed is that there is a consensus view that forms that actually this problem, the best way to deal with it is through a treaty. And that's not necessarily, there's still major disagreements between governments as to whether or not this process is even going to come up with an instrument that's going to work and that this is the best way to deal with it. And so there's some questions that we could go, there is still a big question mark, that we could spend these couple of years going through all of these negotiations and we get to the point where actually we can't proceed any further because the divisions between governments are so significant. And normally you don't have a treaty process start until you have that sort of general consensus that actually there is a commitment here to sort of move forward. So there is that process. The complicating factor as well, particularly at the moment, is that you do have this two-instrument process being developed underway concurrently. And so one of the big challenges is been to try and work out what's the relationship between the international health regulations and this new pandemic treaty. Does the international health regulations stand alone by itself? Does the pandemic treaty connect to it somehow? Is there a trigger mechanism in the pandemic treaty, which is then the IHR is your sort of standard everyday deal with disease outbreaks internationally, but then once it hits a certain threshold, the pandemic treaty kicks in. Is that the way that it's going to work? Now, the reason why that this has been particularly complicated is that governments were originally told, we only want to see minor amendments. Given that we're committing to negotiating a pandemic treaty, we only want to see minor amendments being proposed to the IHR. And what governments did in practice was everything that they wanted in the treaty, they've also proposed to the IHR. So they're like, if we're not going to get it through the treaty, we're going to get it through the IHR. And so now you kind of go, well, what issue is going to be in what instrument? We're not 100% sure. And so there's been a lot of work behind the scenes trying to work out where these issues, such as access and benefit sharing, such as information sharing, which instrument is going to be used. Some of the more complex issues that have come up through the negotiations really is focused on this principle of equity. In the early stages of this process, we saw a lot of low-income countries really advocating for the inclusion of this term common but differentiated responsibilities. This proposal really comes from environmental law, and particularly around climate change. Okay, it's the idea that those countries that were the biggest polluters have got more responsibility to pay to fix the problem that they created. And what we've sort of seen with the pandemic treaty is that obviously there's a lot of lower middle income countries that don't have the resources, that don't have the manufacturing capacity, that for things like vaccines and such that other countries, high income countries have. And so they were really pushing for this idea of common but differentiated responsibilities to be included. And related to that is this question then around access and benefit sharing. And what we've sort of seen is a big divide emerge between low and middle income countries on the one hand and high income countries on the other, that say, well, we're not going to agree to hand over genetic sequencing data until we've got a guarantee that we're going to get access to vaccines and other medical countermeasures. Because they said, like, what happened during COVID was not acceptable, where we are left at the end waiting for these while the rest of the world gets vaccinated. So these issues are very much intertwined. And then one of the big changes which governments complained about last week was the fact that there was some sections in the conceptual zero draft, the original sort of text that was put forward, which talked about recovery, as in like recovery after a pandemic. And they've been deleted from the latest version of the text. And so they've also said, look, that's of concern to us and we're not happy. But the biggest one really has been the deletion of that common but differentiated responsibilities. The time frame was always going to be tight. We're now down to 6 months. So we've got still fairly large divides between high and low and middle income countries, particularly around things like access and benefit sharing, particularly, and when I say access and benefit sharing, I'm talking about access to vaccines. So for the last few minutes, I'm just going to focus on one of the proposals in the instrument, which is the Pathogen Access and Benefit Sharing System, or the PABS. This is important because I think it's got some really significant implications for the international community. So this is currently in the proposed Article 12, and if you are interested in looking at the text of the instrument yourself, you can probably just Google that A/IND/7/X, and you'll probably come up with the text of the instrument. It's around 30 pages, thereabouts. But it's fairly detailed. Governments have sort of said, look, it's not really yet international treaty quality. So we need to sort of work on improving the quality of the text and that, but nonetheless. So one of the big proposals, and there's several big proposals in this, one is for WHO to create a new logistics system to be able to transport everything around the world, things like vaccines and such. But the other one is this PABS system. And basically what it's designed to facilitate is the rapid sharing of genetic sequencing information, or what's described in other circles as digital sequencing information. Basically, it's when we sequence genetic data, upload it, and so the international community can access it and then start to look at using that data to create things like vaccines, diagnostics, and other therapeutics that might be useful in treating people that get exposed to a pathogen. One of the more interesting proposals I find in Article 12 is in paragraph 5, which basically sort of says that even if you're a company, this is the shorthand for it, if you're a company that is developing something which has utilized the pathogen or the information which has been uploaded to the PABS system, then the rules apply to you anyway. So even if you haven't entered into a formal agreement with WHO about using this data to develop vaccines or other sort of therapeutics, the rules still apply to you anyway. Now, from a legal perspective, I think that has a few hurdles to overcome. Principles of natural justice, conceivably, the idea that you are bound by something when you may not have actually formally agreed to it. But they're envisaging that member states are really going to enforce this on companies. And so it's going to be a real challenge to sort of see how this process evolves and works out. Now, what it's predicated on is the idea that governments will agree that when there is a new pathogen which is identified that has got pandemic potential, they're going to upload that digital sequencing information to a platform that WHO controls. And then as a result of uploading it, that various different manufacturers will be able to access it. But in order to access it and then start to make vaccines and other sort of diagnostics, you need to agree to a set of rules. And those rules include things like a donation of the products, either 10% or 20%, depending on the nature. They've got a very sort of interesting framework which they proposed. But the idea being that you will either donate them or that you'll provide them at cost price, a certain percentage of them, of whatever products are generated. And that WHO then will take effectively ownership. And I say that not necessarily physically taking ownership of them, but they will help then distribute those to countries that might not only have access to them. Now, there's already been some disagreements that have emerged amongst member states, whether or not, because under this PABS system, the proposal is that basically each pharmaceutical manufacturer or other company would need to allocate at least 20% of their product for use by WHO, either at cost price or as a donation type arrangement. Now, the problem conceivably with that's already arisen is like, well, is 20% enough? You know, is 20% of those products? I mean, that was basic, and where that number kind of comes from, it replicates another instrument, which I'll get onto in a moment, but it is also what the COVAX facility, some of you might remember hearing about COVAX. It was the multilateral platform that was created to help distribute vaccines during COVID-19. And so it kind of replicates that. But there's countries, low-income countries, that are already saying, look, 20% is not enough. Like, that's not going to meet the need in the event of another pandemic. Now, there's a couple of problems conceivably, and this goes to the challenges really that we're sort of confronting, even just with this one particular article. It's a pretty big proposal that's being outlined. And conceivably, you can kind of understand why the WHO and why governments have sort of suggested this. Largely, the framework that's been outlined has been effectively copied and pasted from another international instrument called the Pandemic Influenza Preparedness Framework. I could go into the details and the history of that framework, but that was negotiated in 2011. And that sort of outlined this proposal of like, if you can have access to this data and information, if you agree to these terms and conditions that you donate a certain proportion of your products, either freely at no cost or at cost, as in you can't make a profit on it. But I would encourage any of you that are interested in this idea and the instrument and the negotiations to have a read of a paper written by Michelle Rourke. She published it in 2019 in the journal Third World Miliband Quarterly, where she talks about the pandemic influenza preparedness framework and identified a number of challenges with that particular instrument and how it would function in practice. And I think there's a really important element there that she draws out, is that the agreements that are designed to operate under both the pandemic treaty, but also under the PIP framework, it actually technically isn't legally binding. And that's a big problem then. So government's kind of signing up to this proposal thinking that it's providing them with a guarantee, and in actual fact, as she's demonstrated with that particular framework, it's not the case. And because this proposal has been largely replicated or taken from the PIP framework and inserted into the text of the pandemic treaty, this problem is arguably not being addressed. And her paper goes on to identify a whole series of other challenges. We've also had on the sidelines, outside of WHO, further negotiations underway under the Convention on Biological Diversity and the Nagoya Protocol, which actually deal with this problem of digital sequencing information. And that's also conceivably going to have an impact on what WHO is proposing. And in particular, one of the key things of the Nagoya Protocol is that governments need to consent in advance to the use of their information that they make available. And an agreement needs to be signed, what's called the Standard Material Transfer Agreement, to enable that. And it requires prior informed consent, and that governments agree amongst themselves to mutually agreed terms as to how that information is going to be used, what products it's going to be used for, what benefits are going to arise from it, how they can generate evidence like that. Arguably, this proposal, though, for the pandemic treaty actually completely destroys the obligations under Nagoya. And that's also a concern then, because it means that basically, and the rationale for it is obviously it's a pandemic, it's a crisis. You don't want to spend conceivably months legally or working out a legal agreement between governments on how this information is going to be used. You need to be able to access it and make it rapidly available. But it does circumvent Nagoya in the event that that proposal goes ahead.
Could you maybe for the audience talk a little bit about why Nagoya was considered a pretty place? Why did it?
Yeah, so the reason why Nagoya and the Convention on Biological Diversity, it arose from 2000. The Nagoya Protocol arose basically around what happened with the sharing of influenza virus samples. And Nagoya, the PIP framework is directly related to that, but there was another process which was started under the Convention of Biological Diversity, and it establishes that countries have sovereignty. They have control over the biological materials that are within their territory. And that's really important because when it comes to any benefits that arise, they say, well, then they have rights to that. Now, otherwise, and what we've sort of seen happen over many years, and there's a great example actually about rubber trees. Originally, they were native to Brazil, and in actual fact, a British explorer went to Brazil, worked out how to transport the seeds of the rubber tree plant and take them back to England. They then transported those seeds to the Asian continent, and as a result of that practice, this was actually back in the early 1900s, as a result of that practice, Brazil lost the monopoly on rubber production. So all of the money that Brazil could have made from rubber, suddenly the market fell out, the bottom of it fell out, and Brazil ended up having 95% of its global production and control of that production, ended up, after these seeds had been taken, only having 5% of the global market, right? So they're saying, well, that was our biological sovereign property, which then got taken, and there's a term which has been given to it, biopiracy. So don't necessarily, you can think about, the whole Jolly Roger type situation, but and the guy with the parrot and the wooden leg, but the concept is the same, really, that these seeds and biological materials and genetic digital information now associated with those materials is being taken without authorization, is being commercialized without permission, and then those countries that own it don't get any benefits from that. And so that's one of the big challenges. Now, I'm going over time, but I'll just finish up on these points. One of the big final so we've got a legal challenge in terms of like the legal instrument itself arguably needs to be fixed, or at least tweaked at the very least, for this to be able to work. There's also this moral question at the heart of this. Some governments are saying, actually, digital sequencing information should have no restrictions on it. It should be shared freely. Basically, you need to, if you get information, it should be uploaded and anyone can access it all around the world. A lot of low-income countries are saying, though, quite reasonably, but this is really important for us. If we don't have any sort of say in how that information is used, we're not going to benefit from things like any vaccines that are developed as a result. And why are they reasonable in saying that? Well, that's exactly what we're just seeing with COVID, right? So there's a moral argument here at the heart, or an ethical argument at the heart of this, between sort of free access, as in no restrictions, versus an open sort of approach to science, whereby you might agree that in the event that you use this information, you have to pay some sort of fee of some sort of recognition or arrangement. There's also some practical elements. I think it's important to mention that this PIP framework, which is this whole system has been predicated on, is untested. We've never had an influenza pandemic since this was negotiated. So we don't know whether or not the legal framework that has been established there, which actually has the legal standing of guidelines, that's never been tested. So we don't know if it's going to work in practice. We've got a framework, but it's never been tested. There's big other practical problems, though, with what this PABS system is being outlined. One of them is what to do with all the gene banks and open access platforms that have already been created all around the world. So there's multiple open access gene depositories, repositories, where seeds and biological materials and other resources have been uploaded, often without consent. And because they're then made available on an open access platform, it means they're out there, anyone can access them. Also, you've got a number of very specialized DSI platforms as well. There's a good example of the malaria one. Malariologists know, anyone working on malaria, they know that they've got their own malaria sequencing information platform that they utilize. So you're kind of like, well, by WHO trying to sort of control this, you're then arguably trying to discourage people from using these existing platforms that have already formed with an established network of scientists that are the specialists in that area, and then putting it into a sort of a more generic sort of platform. So there's big questions around what to do with that. There's some big questions as well around emerging technologies, things like synthetic biology, as well as now the introduction of artificial intelligence and how that's going to change arrangements. You've got a great company here in Boston called Ginkgo Bioworks. They do some amazing sort of stuff. But, they're not even, I don't even know that they're doing work on AI at the moment, but the work that they're doing around things like synthetic biology and that, and sequencing information, really sort of highlight some of the challenges then in trying to be able to control that, and being able to then trace where that digital sequencing information comes from originally. So yes, we've got a crisis, people upload it, it's then shared multiple different ways. Can that information be reasonably traced, whereby you can then actually utilize this mechanism to say you've got to pay access to this? And finally, all of this relies on member state government compliance to actually enforce it. And it's important to note at the moment, the current treaty proposal has no element to it around non-compliance. So if governments do the wrong thing, there's no consequences. Why is that the case? Because that's how governments want it, right? In case it's them that do the wrong thing, because they don't want to be called out for it necessarily. So how we then sort of go through that process. Now, this is at the heart of the treaty, arguably for many countries, and that's why it's so important, this idea of equity. This system has been designed to try and make sure that the next pandemic, we have a better system, a better distribution system with vaccines and such. But I'm not quite sure, because of the rush to get this instrument adopted, I'm not quite sure necessarily that it's the best proposal which is being put forward. And I've gone over time, so I'll stop there. Please forgive me for that.
Can I ask a question?
Yep.
You alluded to this. International health regulations were revised in 2000.
Yep.
And around the time that the large West African epidemic happened, one of the big questions was, well, the 2005 international health regulations required everybody to create the capacity to be able to surveil, detect, respond, but
Yes.
only 20% of the world's population actually did it.
Yes.
So there was no compliance and adherence to IHR. What are your thoughts about the ability, even if we had an accord or a treaty, for compliance adherence if there is a crisis?
Yeah, and I think that's a really good question in terms of the practicality that we're going through this exercise of negotiating a treaty. Because the whole idea of this is that, and the IHR was designed in using Article 21 explicitly because, and the way that it was described at the time, the IHR forms a net around the world, right? This idea that every country is meant to have these core public health capacities to detect and respond to a disease event within their territory and prevent it from spread. And what we've just heard is that actually only around 20% of the countries actually had those core capacities. Governments were given 9 years to build these core capacities under the IHR, and yet by the end of that time period, only a fifth of the world's countries have done so. The big challenge then, now that's an instrument which is binding on everyone, right? Big challenge with the pandemic accord or the pandemic treaty is that you have to have this two-stage process. What I suspect WHO and a number of other governments that are very supportive of the idea of the pandemic treaty are relying on is that politically it's going to be untenable for governments to not sign and ratify this treaty, right? That they could quite publicly be embarrassed by other governments that they're not part of this if they refuse or are hesitating about signing and ratifying it. But I think you could even just look at the Framework Convention on Tobacco Control. Most people can agree that tobacco is a nasty product and it's not good for your health. But in fact, while there are 194 member states of the WHO, there are only 186 state parties to the Framework Convention on Tobacco Control, meaning that there's 8 countries that basically that aren't members. And that's the risk with the pandemic accord, is that you're going to go through this entire process, trying to design a system which applies to everyone in principle, and then have governments that don't then agree to the arrangements. And I think, to give the US government its due, I think its concerns about trying to get a treaty, for instance, passed the US Congress, I don't think the US is alone in that, conceivably. I think I single them out because we're here in the US, but that's conceivably going to be a challenge for a number of other governments. If there's elements of the treaty that, as a result of consensus, have been agreed, but then the individual government has got a concern with it. Now, one of the options that they can always do, this gets very technical in international law, they can lodge a reservation saying that part of the treaty doesn't apply to us, but it's up to governments to agree whether or not that's acceptable or not. Yep.
In terms of enforcement mechanisms, it seems that there's no current enforcement mechanism built in, but like learning about international relations, you learn that there are almost never enforcement mechanisms. Is there something you can imagine as an enforcement mechanism for the courts? Do you think it's possible in the end to have something that actually create any enforcement?
Yeah, I mean, The one instrument which is arguably the best way that you do actually have enforcement is under the World Trade Organization, where if governments do the wrong thing, they're fined. Now, not every government in the world is a member of the WTO, and I will use the experience that Australia has had recently with China, like where in response to the Australian Prime Minister calling for an investigation into the origin of COVID, suddenly Australia found itself being slapped with a whole series of trade-related measures. And it's only now been, and so the Australian government initiated proceedings under the WTO to take China to arbitration over this. And if they were found to have done the wrong thing, then China would have been fined. That process has taken a couple of years. Now we're seeing relations start to improve between Australia and China. And so as part of one of the deals already, like one of those cases has been dropped. And we're seeing, you know, a sort of like, so yeah, I mean, the WTO is the only sort of mechanism really that we've got where there's a clear sort of indication, but even that is not necessarily ideal, because you could end up with a situation where even if an enforcement mechanism was introduced into this instrument, you would have a process of arbitration or negotiation that needs to be effected. And the other important element, you know, there's a lot of misinformation out there about this treaty process in particular, that it's taking sovereignty away from governments and that sort of thing. And I think this is really a clear example that actually governments never agree to that. It's very rare that they relinquish any sovereignty. So the idea that it's going to be this new sort of world power, world government tool to manipulate everything that you do and force you to take vaccines, I mean, that's not what governments would never agree to that for a variety of reasons. But this issue around what happens if governments don't abide by international legal obligations under the Accord is a really genuine, tricky question, which arguably we need to try and reconcile. Now, and to be honest, this is one of the problems with the PADS system as well, because it does rely on government enforcement. And as we saw during COVID, governments introduced measures to prevent the export of products which were seen to be important, right? Because they're like, well, no, we need those for our people. So because there's no enforcement mechanism, it's very likely that governments would do the same thing again. And there's no consequence then for that, even though you've got this instrument which has been approved. So, yeah.
We have a question online. The question from online is, how did the Global South react to the deletion of the common but differentiated responsibilities and capabilities clause?
Yeah, the short answer was they were clearly not impressed. And that, again, is evident from their public comments on the first day of the IMB 7. There was the African Union representative, or the country that was representing the African Union, made a point, and several of the other African countries in particular made a point of noting their objection that this had been removed from the text of the instrument and that they hadn't approved that. But the way that it was explained by the chair of the IMB process was that they had basically taken on all of the different comments and positions of member states in the previous consultations, and they put forward a version of or a text which they believed would be likely to receive the most consensus. And so for that reason, they removed this idea of the common but differentiated responsibilities. How that went throughout the IMB discussions last week, I don't know. We could see the next iteration of the instrument seeing that terminology being reintroduced. There is a genuine question, though, whether or not it's really applicable in this instance, because, again, it's been taken from environmental law, which related to climate change and pollution. It doesn't really necessarily work for a treaty when you are talking about making sure that all governments have got certain capacities to respond and public health mechanisms to respond. So it's a tricky one to negotiate. Yeah.
Clarification question. First, let me say, you made an extraordinarily complex topic really accessible. So thank you for that.
Oh, thank you. I'm not sure if everyone feels the same, but thank you.
Yeah. My question is, why does it going through Article 21 make the PIP framework legal? Because it sounded like before that was the way to go to, have automatic binding. Is the real issue not that it's not legal through that, but it's that this tension with the Nagoya? I just want to really understand what's at stake there.
Yeah, so the PIP framework, this was one of the interesting things. The PIP framework actually was, the World Health Assembly didn't utilize either Article 19 or Article 21. It was adopted as a resolution.
Yeah.
And as a result of that, it really only has the status of effectively guidelines.
But you mentioned drawing that framework into this, right?
Yes, and I think, look, I don't know obviously who's done that. I have a feeling that it's probably the Office of Legal Counsel of WHO. They obviously were instrumental in seeing the PIP framework negotiated. So I think they've probably gone, right, this is a similar problem. So we got agreement on that one. So let's try and use that same sort of approach with this. But the challenge with it obviously is that aside from the problems that Michelle Walker identifies, I think the PABS is arguably, well, let me start it from the other end. The pandemic influenza framework is designed for dealing with one particular type of viruses, and that's influenza viruses, and it's not even seasonal influenza viruses, it's influenza viruses with pandemic potential. And so it's a very, very small subset. What they're proposing with this one is conceivably capturing a whole range of viruses within the PABS system, because you're not necessarily going to know which pandemic or which pathogen is going to cause the next pandemic. And so it becomes much more complicated and much more complex as a result. And on top of that, the mechanisms by which they're trying to utilize it to try and achieve this idea of equity and access doesn't seem to be the best fit. And I think as an international community, number one, we need to get consensus. I heard the other day, in fact, it was yesterday, in the talk by Math CPR, the moderator used the phrase, equity doesn't happen by chance. It has to be a choice. And I think, as an international community, we've still got big divide between high-income countries on the one hand and low and middle-income countries on the other as to what's a reasonable divide here between the manufacturers and the intellectual property rights and the profits that accompany all that, and the people then making it available as widely and accessible as possible. And I think we need to get consensus as a community that actually, yes, we need to fix that. And then once we get that consensus, then we need to sit down and work out what's the mechanism by which to do it. I'm not quite sure that copying and pasting what is largely replicated from the framework is the answer to that, given the nature of the problems. And
thank you.
No worries.
Unfortunately, the session is really right after, so we want to thank Adam for the incredible conversation. And if you haven't grabbed lunch, please go ahead and grab lunch, please. And thank you for those of you who joined online as well. Very.
More than 2 minutes. Legal is
Yeah.